disease care, not health care. And they wanted to become more proactive. And so they set up a they designed a research project where they followed several thousand people over 5 years. They pulled their blood and every 6 months and then watched their medical history to see what happened. And sure enough, they discovered that they could look back on their blood work and actually predict. They could have predicted, once they knew what they were looking at, that they were going to have kidney stones, or that they were going to have a heart attack, or that they were going to have an infection of some sort, or even that they were in jeopardy for cancer. So they called that medicine, that form of looking at blood chemistry, functional medicine. And this slide really talks about what functional medicine is. It's personalized. It deals with primary prevention and the underlying causes of disease, and seeks to treat those underlying causes, seeks to find the lever and tap the lever in order to prevent serious chronic illnesses from developing. It is science-based. We use lab tests of all sorts, but what's different is that it individualizes it, and we'll talk about that in just a minute. So they're looking at biochemical individuality. It's very patient-centered and all about patient care rather than disease care. And I love this quote here from Sir William Osler. It's more important to know what patient, I cut the rest of that quote off there, sorry. Basically what he said is it's more important to know what patient has the disease than the disease has the patient. And what he's saying is it's just really important to treat the patient rather than the disease. Many of us, of course, have been ill, and we may have overheard the nurses or the staff or the doctor say, you know, she's the one with kidney illness, or she's the one with cancer of the breast, or so we're being identified with our disease rather than as ourselves. And functional medicine is all about health as a positive vitality. So going back to those blood tests that the functional doctors did, it's important for you to understand that lab tests are interpreted from within the scope of what they call normal lab ranges. And normal lab ranges are based on statistical norms. So when a lab opens, they begin plotting all of their results for, let's say, protein. And eventually a bell curve becomes apparent. And then they statistically lop off 3.5% to 7% on one side and on the other side, and they say that's the normal range. So at the bottom of this screen, you'll see the normal range. When they did that research, the functional doctors discovered that if they narrowed the lab range, then and they read the labs that were along these sides here. So if your results fell along here or along here, then they could predict that you were going to have a problem. And if they corrected those problems, then they knew that they were going to spare you the problem of an upcoming illness. So what's normal is not necessarily healthy. For instance, what's normal in San Jose, the healthiest city in the nation, is not what's normal in New Orleans, Louisiana. And the link that I have there is to a study of, they picked 50 cities in the United States and ranked them according to body mass index, environment, diet, vegetable and fruit consumption, et cetera, and San Jose came out at the top and New Orleans came out at the bottom. And it's illogical that we would go from from in here to out there instantaneously, right? Well, I suppose if you drank a bottle of nail polish remover or stepped out in front of a Mack truck, you would end up going from here to there or from here to there instantaneously. But more than likely, it's a process by which we get from in here to out there. So in functional medicine, we use a number of assessment tools. We use plain old blood chemistry, and there are a number of places where you can acquire these tests on your own via the lab. If you don't want to go to your doctor or connect with me, you can actually order the blood chemistry that I use from a place called directlabs.com. The price that I have here is the price that I get. I think your price on that would be about $99. Also, I use saliva testing, and I'll explain the benefits of that in a bit. And then, as I said before, I rely a tremendous amount on the metabolic assessment form and the neurotransmitter assessment form. I've used those two in conjunction with the saliva testing and the blood chemistry for so many thousands of patients by now that I can actually, I feel like I have a bit of a crystal ball. I can look at those metabolic assessment forms and neurotransmitter assessment forms and predict fairly accurately what's going to show up on your blood chemistry just on the basis of your own symptoms of imbalance. So if you're suffering from fatigue, from headaches, you keep getting colds and flus, your hair's falling out, you have breakfast and your belly bloats. By the time you get to the office, you wish you'd put a pair of pants on that was bigger around the waist. You have chronic allergies. You can't get yourself started in the morning. You need to have caffeine or sweets. Any of these symptoms are signs that your body is not functioning as it should, and there are answers and solutions for all of these. So here we're going to begin our lesson that I call Physiology 101. Lots of us don't have a clue what our body, how our bodies function, where organs are. And when I was in medical school, I just fell in love with anatomy and physiology. We are such miraculous beings, and the functions of our body and our organs are so absolutely incredible that I have this judgment that I think everybody needs to know at least a little bit about how their bodies are working. So when my patients come to me, I help them to understand how all the bits and pieces are connected. You know, these days we have gastroenterologists, we have neurologists, endocrinologists, there are specialists, and we don't have very many general practitioners. So we don't have very many doctors that are viewing us as holistic creatures, where we have doctors that are seeing us as their specialty, as their bits and pieces. But, you know, there was an old song that said the knee bone's connected to the shin bone and the shin bone's connected to the ankle bone. Well, all of us connects with all the rest of us. And I think it's important to understand how it all interconnects. So this evening you're getting a lesson in how some of your endocrinology system connects. So here we have a depiction of your kidneys, which are major detoxification organs. They sit just about at waist height and along your back. And so a lot of times when people are having low back pain, it's not muscular pain, it may be kidney pain. Your adrenals sit on top of your kidneys. They're little pyramidal shaped organs. And then